draw a clock test. This is more used, it's a screening tool test used to assess for cognitive function, and it tends to evaluate multiple cognitive abilities at the same time, such as executive function, visual, spatial skills, planning, and abstract thinking. The clock drawing test tends to use both sides of the brain, and is quite useful in identifying deficits such as stroke, dementia, or other neurological conditions, such as MS. So the process of the screening test itself involves instructing the patient to draw a circle and place numbers of a clock in a circle, and also to set hands to a specific time. There is also the option of drawing a circle for the patient and just telling the patient to fill in the parts of the clock and kind of copy. So after the patient draws the clock, there are some questions you need to ask to help you understand better what is going on with the patient. The first one is planning and sequencing. Are the numbers placed correctly, and are they evenly spaced? The next one is conceptual understanding. Does the patient understand how a clock should look like? And did he draw a clock? The third one is spatial organization. Are the numbers aligned properly, or they are all hunched together on one side of the circle? Then also motor execution. Can the patient physically carry out the task? Is he able to draw a smooth circle, or there's some kind of, it looks more like a rugged circle? Then the next one is comprehension. The instruction that was given, was the patient able to understand what the instruction was and able to carry out the task? So this is an illustration of the common type of the clock drawing errors. We have the first one, which is the graphical difficulty. We can see that the circle is not a small circle, and also the hands of the clock is quite rugged. I'm going to explain more about what each one of this means, but this is just to have an idea of the different type of clock drawing errors that could occur. So we have the stimulus bound response, we have the conceptual deficit, we have the spatial slash planning deficit, and also we have the preservation error. So in regards of the interpretation, the first thing is to look at the size. In regards of the size of the clock that was drawn, was it a very large clock or a small clock? So large clock tends to be reflects an impairment of the executive part of the brain, which is usually the frontal lobe, and also the right parietal lobe functioning. And this impairment is more common in patients with Hutchinson's dementia. So also, if it's a small clock that was a tiny one, there could be micrographia, which is an impairment of the brainstem, and this can be seen in Alzheimer's dementia. Also, the graphical error. This is when there is a problem with coordination of fine motor control and planning. And this can also be seen in vascular dementia and Hutchinson's dementia more than Alzheimer's. Then we have the stimulus bound errors, which is more of executive functioning deficit, more common in Alzheimer's and Hutchinson's than Parkinson's and frontotemporal dementia. Then also the conceptual deficits. It doesn't look like a clock, or the hands do not communicate. It does not communicate a time. So this is the example. You can see that the lines are not joined together, and even the numbers are not complete. there's misinterpretation of the time basically. Then also the spatial deficits, it reflects a neglect of one side of the brain. This is more commonly seen in CVA, in stroke, where there is a neglect of one side depending on the side of the brain that is affected in the stroke. So for example, if the patient has if there's right CVA, which means the left side of the brain is affected, then it's going to cause a neglect on the left side. So there will be a crowding of all the numbers on the right side of the circle. And and it's then there could also be that the numbers are written outside the clock face, or they are written anti-clockwise instead of clockwise. Then the last one is preservation, which when there is presence of more than two hands, and this reflects a failure to terminate the ongoing sets of tracing the hands or preservations of numbers. Like there's abnormal pronunciation of the number. This is an example that we can see. So instead of the number stopping at 12, the patient will keep on going on, and will draw out different lines trying to interpret the instruction that was given basically. Okay, yeah, that is the end with draw a clock test.